Are you one of the millions of people who deal with nagging back pain? You know, that constant ache or sharp twinge that just won't go away, making it hard to sit, stand, or even get a good night's sleep. Well, what if I told you that relief might be simpler than you think, and you can start feeling better right in the comfort of your own home? In this video, we are going to dive into the most effective, science-backed strategies to manage and relieve back pain. We cover everything from simple stretches you can do right now to lifestyle changes that can make a huge difference in the long run. So, if you're ready to say goodbye to back pain and get back to living your life to the fullest, stick around because you won't want to miss this. Hello and welcome back to the channel. I'm so glad you're here today because we're tackling a topic that affects almost everyone at some point in their lives: back pain. It's one of the top reasons people miss work and visit the doctor. But here's the good news. Many cases of back pain can be managed and even resolved with the right approach. Now, it's really important to remember that I'm not a doctor. The information in this video is for educational purposes. If your pain is severe, the result of an injury, or just isn't getting better, please see a healthcare professional to get a proper diagnosis. Your health is the #1 priority. With that said, let's explore the most common causes of back pain, which will help us understand the best ways to treat it. So, what's actually causing that pain in your back? Well, it can be a combination of things. One of the biggest culprits in our modern world is poor posture. Other factors can include sleeping on an unsupportive mattress, carrying extra weight, and even stress, which causes your muscles to tense up, leading to stiffness and pain. Understanding these root causes is the first step, because now we can focus on the solutions. Alright, let's get into the good stuff, the practical steps you can take to relieve back pain. The first, and perhaps most important, is gentle movement and stretching. When your back hurts, your first instinct might be to lie down and not move. While rest is important for a new injury, too much inactivity can actually make chronic pain worse by causing your muscles to become stiff and weak. Gentle movement increases blood flow to the area, which helps deliver oxygen and nutrients that promote healing. So let's go through a few simple, effective stretches you can do every day. First up is the cat-cow stretch. This is a fantastic stretch for gently mobilizing your spine. Get on your hands and knees, with your wrists directly under your shoulders and your knees under your hips. As you inhale, drop your belly towards the floor and look up, arching your back. This is the cow pose. As you exhale, round your spine up towards the ceiling, tucking your chin to your chest, like an angry cat. This is the cat pose. Flow between these two poses for about a minute, moving with your breath. This simple movement helps to stretch the muscles of your back and improve spinal flexibility. Next, let's do a knee-to-chest stretch. Lie on your back with your knees bent and your feet flat on the floor. Gently pull one knee up towards your chest, holding it with both hands. Lie on your back with your knees bent. Cross your right ankle over your left knee. Then, reach through the space between your legs and grab the back of your left thigh. Gently pull your left leg towards you until you feel a stretch in your right glute. Hold for 30 seconds and then switch sides. Consistency is key with these stretches. Try to do them once or twice a day, especially in the morning to loosen up or before bed to release tension. Beyond stretching, strengthening your core is absolutely crucial for long-term back health. Think of your core as the central pillar that supports your entire body. A strong core takes the pressure off your spine. You don't need to do hundreds of crunches. In fact, exercises like the plank are much more effective and safer for your back. To do a plank, get into a push-up position, but rest on your forearms instead of your hands. Keep your body in a straight line from your head to your heels. Engage your abs and try to hold it for 20 to 30 seconds. As you get stronger, you can increase the time. Another excellent core exercise is the bird dog. Start on all fours. Extend your right arm straight forward and your left leg straight back simultaneously, keeping your back flat and your hips level. Hold for a few seconds, then return to the start and switch sides. This exercise builds stability in your spine. Now, let's talk about your daily habits. Small changes here can have a massive impact. First, let's fix your posture. Whether you're sitting or standing, imagine a string pulling the top of your head towards the ceiling. Your shoulders should be relaxed and back, not hunched forward. If you work at a desk, make sure your setup is ergonomic. Your screen should be at eye level, your feet flat on the floor, and your chair should support the natural curve of your lower back. You can even use a rolled-up towel for extra lumbar support. And most importantly, get up and move around every 30 minutes. Do a quick stretch, walk around the office, or just stand up. Your back will thank you. Your sleeping position matters too. If you're a back sleeper, placing a pillow under your knees can help maintain the natural curve of your spine and reduce pressure. If you're a side sleeper, which is often recommended for back pain, place a pillow between your knees. This keeps your hips, pelvis, and spine in better alignment. Try to avoid sleeping on your stomach, as this can flatten the natural curve of your spine and force you to turn your head, which can lead to neck and back strain. And of course, a supportive mattress that isn't too soft or too hard is a worthwhile investment in your health. Finally, let's not forget about heat and cold therapy. For a new injury or acute flare-up, applying a cold pack for 15 to 20 minutes can help reduce inflammation and numb the area. For chronic muscle soreness and stiffness, heat is your best friend. A warm bath, a heating pad, or a hot water bottle can help relax tight muscles and increase blood flow. You can alternate between heat and cold to get the benefits of both. And remember to manage your stress. Stress leads to muscle tension, which makes back pain worse. Practices like deep breathing, meditation, or even just taking a walk in nature can help calm your nervous system and release that tension. So, there you have it, a comprehensive guide to managing your back pain at home. We've covered gentle stretches like the cat-cow and knee-to-chest, core strengthening exercises like the plank, and crucial lifestyle adjustments to your posture, sleep, and daily movement. Remember, the key is consistency. These aren't quick fixes, but habits that, when practiced over time, can lead to lasting relief and a stronger, healthier back. Start small, pick one or two things from this video to incorporate into your routine, and build from there.